Hello, this is Lindsay Vanderlyn speaking, and my group's public health project is on alcohol abuse among college students. It's also presented by Allison, Adriana, Daniela, and Kate, and we all hope that you enjoy it.
Alcohol consumption is often seen as a rite of passage in college and university settings. According to the National Survey on Drug Use and Health, approximately half of full-time college students drank alcohol in the past month, and more than 30% engaged in binge drinking. Alcohol abuse is linked to injuries, assaults, rapes, and drunk driving. For instance, more than 600,000 students between the ages of 18 and 24 were assaulted by another student who had been drinking. Additionally, there's many alcohol-related issues such as liver cirrhosis and damage. Students that abuse alcohol tend to perform poorer on academics than their peers who do not. Although the instance of drunk driving among college students greatly varies across states, this puts other drivers on the road at risk too. In order to help reduce these negative effects, administrators and officials in universities and colleges should implement alcohol abuse prevention and intervention strategies.
The CDC refers to the principles of epidemiology as the 5 W's: who, what, where, when, and why, of how a disease spreads and the risk factors that increase the spread. When researching alcoholism and binge drinking, I originally thought that alcoholism was not a disease. To my surprise, alcohol abuse is often considered a disease because it is a physical addiction that has symptoms and can require medical attention. People can experience physical symptoms of sweating, nausea, and headaches when withdrawing from alcohol. In our study, we are focusing on college students and why they are at an increased risk for abusing alcohol. The college environment brings young people ages 18 to 22 together with parties and other social events. When the student already has other risk factors such as a family history of alcoholism or certain personality traits such as anxiety or extroversion, this can make it easy for them to fall into the trap of binge drinking and dangerous drinking culture. Most college students are educated on the negative effects of alcohol abuse, but they believe that these things won't happen to them. This brief overview can help us begin to get to the complex roots of this issue.
Research conducted on college students' binge drinking goes back to 1976 after health issues started popping up from excessive alcohol consumption among this age group. There are a few biostatistics to go over in order to prove even further that something must be done about this issue. There are roughly 65% of college students drinking alcohol, and most of it is considered binge drinking. This means that there are more college students in the world drinking alcohol on a regular basis than those that are not. A typical night for a college student includes around 9 drinks, when the usual amount of other ages is between 5 and 7. This not only leads to deaths annually, but also leads to other issues such as assault, sexual assault, and poor academic achievement. Some North Carolina schools attempted to enact organizations in order to decrease the injuries directly related to college students binge drinking. They did have some success, but on a very small scale than they anticipated. This is a great start, but unfortunately has not made big enough of an impact. CDC put a statistic out that binge drinkers in college include ages 18 to 24, which means half of this population isn't even of age to legally drink. This also includes the direct correlation between college students and peer pressure, showing that peer pressure is directly related to binge drinking. These biostatistics prove that this important issue is not being addressed as it should.
From a social and behavioral perspective, researchers have found that the increase of alcohol consumption in college students is often related to students' attitudes toward alcohol, perceptions of the consequences associated with consuming it, and the use of it for social interactions. Recently, it was also concluded that social media plays a big role by portraying alcohol as a positive aspect of the college culture. Many interventions that have been created prove to be effective for short periods of time, with most being focused on educating students about safe alcohol consumption. However, without tackling the root cause of the behavior, it is hard to see a decline in binge drinking within these populations. Meta-analysis of several interventions have called for more longitudinal studies, more diversity of the sampling population, and a bigger sample size. In my role, I will focus on learning more about the associated behaviors as well as the stressors and ways to effectively use healthy coping mechanisms among a population that often uses alcohol and other substances to alleviate stress and anxiety.
There are policies set in place regarding alcohol consumption on the federal, state, and local level to cohesively create a safe drinking environment in the United States. These entities make laws regarding the selling and manufacturing of alcohol as well as the appropriate age to allow citizens to drink. The first time policy came into effect in America regarding alcohol consumption was in 1919 when the Prohibition occurred. Under the 18th Amendment, the sale and manufacture of alcohol was prohibited in the U.S. This, however, did not last long, as in 1933, Congress ratified this amendment and had the 21st Amendment, which appealed the prohibition. This now allowed Americans to freely sell, manufacture, and transport all alcoholic products. This ratification also gave the states the power to make decisions regarding alcohol consumption in their specific state. The federal government, however, was still given the right to tax this alcohol. The major federal policy came into effect in 1984 when the government passed the Federal Uniform Drinking Age Act, which set the legal drinking age to 21 in every American state. This act not only determined the appropriate legal age to drink, but also determined whether alcohol be permitted or imported in any specific state in general. The federal government determines what is considered an alcoholic beverage in the first place, and for us in the United States, it's 0.05% alcohol in any drink. The federal government also regulates the nation's acceptable blood alcohol level for being legally intoxicated while driving a motor vehicle, and that is 0.08. State policy regarding alcohol may differ between states. However, all states have some general guidelines or laws that are similar. For example, the maximum alcohol content per drink, maximum number of drinks allowed to be served at once, and the licensing of liquor stores is all regulated under specific state governments. Additionally, in some states, 18 to be specific, they prohibit the sale of alcohol to pregnant women. One common policy between all states is the checking of legal identification when purchasing alcohol. There are multiple laws and policies set in place to regulate drinking in America on several different levels. These policies are made to protect citizens and specifically helps college students. Although there are no federal laws pertaining to binge drinking on college campuses, these laws are set in place to limit the severity of the problem.
In order to specifically target binge drinking among college students, we are going to target the organizational and interpersonal levels of the social ecological model. This intervention will begin with creating a committee at each public university or college, consisting of one representative from each school-affiliated group, such as athletic teams and clubs. This will help determine the special needs of each subgroup and be inclusive to all ethnic and racial minorities. The addition of specialized counselors to this committee will target the interpersonal level. The interpersonal level is crucial because alcohol drinking among college students is seen as a norm and a well-established culture across the nation. This level will help students change their misperceptions of drinking, as well as adopting healthy coping mechanisms and dealing with peer pressure. A previous intervention consisted of a randomized controlled trial with one dose of a motivational session for college student binge drinkers. According to Borsari and Carey, after the 6-week follow-up, there was a significant reduction in the number of drinks college students consumed per week and month. Implementing the motivational aspect into the interpersonal level may prove to be effective. However, because this was a one-time intervention, the results may be short-lived. Therefore, our intervention will require the committee to be active year-round to create activities such as retreats to keep students involved. Universities and colleges may also be able to provide a simple one-credit course to get a hands-on applied education about alcohol and drinking for college students across the nation.